What's up, everybody? In today's video, we are going over groin pain. It's a case study of somebody who was dealing with groin, and what we would say is the area between the hamstring and the adductor, kind of that inner spot there. That's what they were showing me. And if you're interested in that case study, I'll take you through kind of how they presented and then maybe 2 exercises that worked really well for them. My name is Dawn. I work at Performance Place Sports Care, just one part of the locally world famous chiropractors here in Costa Mesa, California. And I'm just gonna hop right into the case. So again, this person was dealing with groin discomfort, okay? And then the area, so if we find our hamstring here and we find our inner thigh muscle, I do this thing because this is what they were showing me. It hurts right here. You know, this thing like right here. And so we realized where they were pointing was just right in between hamstring and adductor muscle. There's a little space, septum, whatever you want to call it. That's where their pain was presenting. They couldn't quite tell if it was like adductor muscle, butt cheek, hamstring. Hard to really identify where it was. Symptoms moved around though. Sometimes it was just the groin. Sometimes it was just that spot right there. Other times it was kind of in this outer hip. Sometimes it felt like the SI joint. And just kind of moved around depending upon the day. Walking hurt too much, okay? The moment they sit down, definitely hurts the groin. Could not even think about going for a jog. Knows that strength training is good for them, and they were trying to do some strength training stuff, but just felt really confused on like what's provoking me, because at the end of the day, it just doesn't feel good when I do strength. So was just having a really hard time figuring out what they should and shouldn't be doing, and reached out. Groin pain felt pinchy. That inner spot felt grabby, achy around the other areas. That's kind of how they described it. So I'm going to show you what we would call a first aid exercise that worked really well to reduce the discomfort. We'd come back to squatting, side bending, and sitting as ways to see if what we were doing was working for them. So show you the first aid, and I'm going to show you one other kind of stretchy exercise that we paired with it to dose out for a week that really, really worked well. So again, I want to just always say that if this stuff isn't working for you guys, don't get discouraged. There's many, many ways to create the right recipe for your symptoms. Somebody with the exact same issue as you might respond to a completely different program. So ask a health professional to help you, get a proper examination done, figure out what right program works for you. It should be progressive, it should be hard, it shouldn't be painful. You should see some pretty significant improvements in a decent amount of time, okay? So I'm starting to get into this position because this is what we call tactical frog. And so what we worked through is how far can you open up your knees away from each other? Yeah, that feels fine. I feel a little stretch in my inner thighs. Great, now sit back. Yeah, that kind of intensifies that stretch. Awesome, work through that 10 times, okay? And what's important with this one, if you are doing it at home following along, is that any stretch that you feel should either remain the same or get better. It should never, never get worse on you. It should never recreate your symptoms. If you're feeling symptoms right now, but they're kind of low level, just kind of whispering at you, play with it, okay? There's nothing wrong with that. If it starts to reduce, then you know this is probably okay for you to explore. Again, if it's not getting better or it might get worse on you, don't do this exercise. So again, she couldn't even feel a stretch anymore, so we brought ourselves down to the elbows, and then we continued to work through this. So showing you from a different angle, we worked through about 3 or 4 rounds, I believe, of 10 to 15 reps of this. And so feeling that kind of inner thigh stretch here. Everybody's body looks different in this one, so what I want is not like a kind of butt out position, but I want more of like a turtle shell as you're doing this. That way our hips don't feel pinchy, our groin feels fine, and we're just working through that inner thigh stretch, okay? So we go back to squatting after that, and the area underneath there got better. Groin was still kind of there, but a little bit better. And then the squat, squat felt better. Side bending was about the same, sitting significantly improved. And so, yeah, those were the things we were coming back to. So tactical frog, 3 to 4 rounds, improved 40–50% of the symptoms that quickly. So another thing that I paired with it, just based on this person's movement assessment, I had a feeling. So we went into what I would call, I don't want to preface this with any sort of diagnosis at all, but this is what we call an obturator nerve glide. Shout out to Anna Hartman. She's the one who taught this to me. So this is symptom side here. We're going to take this leg. We're going to find a place that feels okay for us, and we're going to lunge into that leg until we feel a stretch somewhere in that inner thigh again. And then we're going to stay with that stretch slightly. For this particular person, it was like, oh, there's my symptom. Yep, I feel it. Okay. Find a little bit of it. Don't find an intense amount of it. Bend the chin towards the chest. Round the back a little bit. Twist away from it. Oh, that changes it for some reason. Wonderful. Move the head up, down. Stay with that stretch. Move the head up, down. If you are trying this at home and it's not changing anything, then this is probably not going to work for you. But for this person, looking down made it feel better. Looking up brought the symptom back. So we went through a little nerve glide there, 3 rounds as always for 10 to 15 reps, playing with a little bit of discomfort, never letting it get worse, and tracking if it's actually getting better the more that we do. Pairing that tactical frog with this stretch, we got into some other challenging exercise to pair with it because strength training was important for her, so we found what she could do without provoking it. And over the week, she has noticed some significant improvement. So again, don't get discouraged if this doesn't work for you. There's a webinar that's going to pop up at some point in the video if it didn't already. Click on that, take advantage of that free resource. It's educational. It's got more stuff on there for you to try. So does our YouTube channel. If you're sick of scrolling through YouTube and you just want some guidance, click on the link below, give us a call, shoot us an email, start a conversation. Let's guide you down the right path.